Hey everyone, and welcome. So glad you're here. And a quick note, Mehdi told us that you all really enjoyed the last few explainers, which is just awesome to hear. Today, we've got a really cool medical mystery for you. It's one that starts with something pretty routine, a chest X-ray. But what was found on it, well, it's the kind of thing that would make any doctor's heart just stop for a second. Let's get right into it.
So I want you to imagine for a second that you're the radiologist. You're looking at an X-ray, and boom, you see something that looks, well, it looks like a tumor. Maybe even 3 of them. Your mind immediately goes to the worst-case scenario, right? Cancer. But what if it's not a tumor at all? What if what you're seeing is more of an anatomical illusion? That is the big question we're going to unravel today. Is this a deadly growth, or is it just a trick of fluid and anatomy?
Okay, so here's our case. This is the X-ray of an 80-year-old man, a heavy smoker with a 50, that's 50, pack year history. He's come in because he's having a harder and harder time breathing. And when they take this image, they see not 1, not 2, but 3 pretty clear mass-like shadows in his right lung. Now, you take his age, you take that smoking history, and neoplasm, a tumor, shoots right to the very top of the list of possibilities. I mean, this image is practically screaming problem.
To figure out what's really going on here, we have to understand the layout of the land, so to speak. The solution to this mystery isn't hiding in some rare disease, but in the basic, fundamental structure of the lungs themselves. We've got to look at the dividing lines.
So here's a fun fact you might not know. Your lungs aren't identical twins. Nope. Your right lung is a little shorter and wider because it has to make room for the liver underneath it. It's split into 3 sections, or lobes, by these deep grooves called fissures. The left lung, on the other hand, has to share space with your heart, so it only has 2 lobes and 1 fissure. And these fissures, they are the absolute key to this whole story.
Let's start with the big one, the oblique fissure, also known as the major fissure. This guy is the main dividing line, and it's in both lungs. Just think of it like a long, slanted cut that separates that big lower lobe from everything sitting on top of it.
Now here's the one that's special, the horizontal or minor fissure. You only find this in the right lung. And just like its name suggests, it runs more or less horizontally. It slices off that small wedge-shaped middle lobe from the upper lobe. So, right lung, 3 lobes, 2 fissures. Left lung, 2 lobes, 1 fissure. Simple enough, right? Well, it's this perfectly neat blueprint where things start to get really interesting.
You know, this is where our little medical detective story really takes a turn. Because that clean, simple diagram with the lungs we all learn about in school, it's more of a suggestion than a hard and fast rule. The reality is that our internal anatomy has a ton of variation, especially when it comes to these fissures.
Check out this number. Seriously, a classic study done on cadavers found that the minor horizontal fissure, that little line between the right upper and middle lobes, was incomplete in a whopping 94% of the lungs they looked at. 94%! That means for almost all of us there isn't a clean separation there. The lobes are actually fused together in places.
And it's not just that one little fissure. Modern CT studies show that this is true for all of them. Just look at these wild ranges. For the right major fissure, it can be incomplete anywhere from 17 to 85% of the time, the left 19 to 74%. This isn't some rare defect we're talking about. This is just common, normal human variation. The lines just aren't always complete. And get this, it's not just about lines being incomplete. Sometimes people have extra ones. About 1 or 2% of the population has something called an azygosed fissure. It happens when a vein takes a weird detour through the lung during development, basically creating an extra little fold. It's just another perfect example of how our bodies don't always stick to the textbook design.
Okay, so our lungs can be a little different from person to person. You might be thinking, so what? Why do we care if these lines are complete or not? Well, it turns out these tiny anatomical quirks have massive real-world consequences, affecting everything from how diseases spread to whether or not a cutting-edge medical treatment will even work.
The phrase you need to know here is collateral ventilation. It sounds complicated, but it's pretty simple. When a fissure is incomplete, it means there's a little land bridge of lung tissue connecting 2 lobes that should be separate. And that bridge allows air to sneak from one lobe to another through these tiny back channels, totally bypassing the main airways. It's like a secret passageway for air.
Let me give you a perfect example of why this matters so much. There's a modern treatment for severe emphysema, where tiny one-way valves are placed in the airways of the most damaged part of the lung. The whole point is to let trapped air out, but not let any new air in. The goal is to get that lobe to shrink down, which gives the healthier parts of the lung more room to breathe. But what happens if the fissure isn't complete? That's right, collateral ventilation.
Air just sneaks right back in from the lobe next door, that target lobe never deflates, and the whole expensive procedure is a total failure.
And it goes beyond just treatments. You can think of complete fissures as biological firewalls. They can contain an infection, like pneumonia, keeping it locked inside a single lobe. But as this quote from a recent study points out, when that wall is incomplete or not there at all, things like pneumonia and even cancer can spread way more easily. It also makes life really difficult for surgeons who are trying to remove just one lobe, because those hidden connections can cause all sorts of problems after surgery.
Okay, so now we know all about fissures, how they can be incomplete, and what happens when air and fluid can cross those boundaries. Let's go back to our 80-year-old patient and those 3 scary-looking tumors.
So the big reveal. It wasn't cancer, it wasn't a tumor at all. The patient was actually in severe congestive heart failure. That means his heart wasn't pumping efficiently, causing fluid to back up into his lungs. And where did that fluid go? It settled right into those natural dividing lines, the major and minor fissures of his right lung. And because the fluid was trapped or loculated, it balled up into these dense shapes that looked exactly like a solid mass on an X-ray.
And here is the beautiful proof. The patient wasn't sent for a biopsy or started on chemo. He was treated for his heart failure with diuretics, basically drugs that help the body get rid of excess fluid. And look at this. After only 4 days of treatment, they took another X-ray. And the tumors? Poof, completely gone, vanished into thin air. This is exactly why it's called a phantom tumor. It's a radiographic ghost created by nothing more than fluid in the lung's natural creases. I mean, what a case, right? It's such a powerful reminder that in medicine, things are often not what they appear to be. And understanding the subtle, sometimes invisible ways our own bodies are built is absolutely critical to getting things right.
So, what are the big lessons here? Well, first, the normal human anatomy we see in books is just an average. Variation is the rule, not the exception. Second, those incomplete fissures create these secret pathways for collateral ventilation, which has huge effects on how diseases spread and how well treatments work. And finally, just knowing that fluid can get trapped in these fissures can stop a doctor from making a terrifying misdiagnosis. It is literally all about reading between the lines.
It really makes you think, doesn't it? The phantom tumor was a puzzle solved by understanding the visible lines of the lung. But it leaves you with a much bigger question. What other invisible lines, what other variations and forgotten folds in our anatomy hold the keys to understanding our health? Something to chew on. Thanks so much for diving in with us today.